there will be no new restrictions between now and New Year in England. Was this the right call by the Health Secretary and the Prime Minister? I speak to Tobias Ellwood, Conservative MP and Chairman of the Defence Select Committee. Joins me now. Tobias, good morning to you.
Good morning to you.
Has the Prime Minister and the Health Secretary, have they taken the right decision?
I think they have. I think there'll be huge relief across England that the Health Secretary has confirmed that there are no new restrictions for the time being. We are getting a better intelligence picture, be able to put all the data together. Sajid Javid has access to data which is yet to be released as well. This not only includes the transmissibility, but the lethality of it, the number of cases in hospitals and so forth. But also, you spoke about the health professionals. The Prime Minister and the Health Secretary also have to consider the wider economy, the impact on the particularly things like the hospitality sector, whether the NHS can cope, as well as the mental well-being, if you like, of the entire nation. And when you put all those factors in together, I think this was a bold call by the Prime Minister, but I think for the moment, the right call to make.
Having now spoken to two health professionals, one of them slightly stronger than the other, but both appear to consider that the Health Secretary and the Prime Minister are taking the wrong decision. Are they being too overcautious?
Well, as I was just trying to touch on it, the health professionals will focus on their particular area of expertise. They want to make sure they've got their backs covered. They want to make sure that they're giving the right advice and so forth. We need to take this into the round. We're in a very different position from last year, let's not forget. I think people are much more responsible about their own voluntary protocols, if you like. Our routines now and mask wearing and keeping distances and so forth. And most critically, we're getting those jabs done. And it's very, very clear that if we're going to get out of this, then we need to keep getting our vaccinations completed. So we're in a far, I think, wiser position than a year ago. And therefore, that allows the Prime Minister to take a more bolder path than perhaps he would have done when we were less understanding of where things are.
Why is it that we're still not getting good data from the government? So, for example, when we look at the number of people who are in hospital and they say, oh, yes, they've got COVID. But why are we not looking at people who are in hospital with COVID as opposed to people who are in hospital from COVID? Because surely there are people who are picking it up. They've got underlying health conditions, all sorts of things that we as the public need to know and need to have confidence in the decisions that are being taken, so that we can understand. And at the moment, the data that's being presented to us is so poor that it means that the trust, if you like, in government, in the decisions that are being taken, is ebbing away.
I think I would agree with you, and the government must be conscious of that. They can actually perhaps rebuild that trust, which eroded a little bit towards the end of last year, by providing clarity. If you want to take the nation with you, if you want to take Parliament with you, then the more data that you can provide to make your case, it's easier for people to follow. So I'd absolutely agree with you for us to better understand. I remember when that first case of the Omicron variant in the UK arose, where somebody had died, we weren't clear what the details were. And what we're seeing, and this is a real important message here, which I think you've been saying as well, is that the people who are filling up our hospitals are those who choose not to get jabbed. And the danger here is that those people who are refusing them are actually causing a burden on the rest of us. It's so irresponsible that they are refusing to actually get those vaccinations. That's how we get out of this. So,
okay, do we get out of that though? But there are two possible outcomes from that. Because there will be those who are listening and saying, listen, I don't see why the government should be able to tell me to get a jab, and I don't really want to have them commenting on my health. Thank you very much indeed. Alternatively, we could be going down the route which the New Yorkers have done in New York State. They're saying that vaccines are now going to become mandatory. What would you suggest is the route out? Do you think that we need to make vaccines mandatory?
Well, you're jumping ahead a little bit. If I can just finish that point, because it is related to your important question as to whether you go down the mandatory angle. You avoid the mandatory angle by people getting themselves jabbed. Come to Bournemouth, Christchurch, or Poole hospitals in my area, and the absolute majority of people that are in A&E, that are in intensive care because of COVID, have had no jabs. And they are putting a massive burden on the NHS, preventing other illnesses from being treated because they are so overwhelmed. So you avoid that question of mandatory passports and vaccinations and so on like that by us volunteering to make sure that you do the right thing, that you support Britain and get in with the program that everybody else is and getting themselves vaccinated. We need to understand that it's the stop-start approach that we've got at the moment is almost killing our economy. The fact that we're almost having to consider lockdown and then open up again, another final push, get us through Christmas into the new year. We can avoid this if everybody gets jabbed. But I'd go a step further than that to say, again, you avoid mandatory vaccinations by making sure that government has a program to say, let's consider now the 4th jab, the 5th jab, and so forth. This pandemic has lasted a couple of years. I'm afraid is likely to last a couple more. We need to have the better logistical supply chain in place to make sure that we can weather this storm, not go, on the bus, off the bus approach, repeating very similar to what we were in the position we were this time last year.
But how many jabs are too many jabs? I mean, we're already talking about the 4th. I've just had my 3rd. I mean, it's just like, really?
So the mindset we need to adapt is similar to flu. We need to recognize that simply because of the way that this mutates, if only 40% of the world is vaccinated, there's an awful lot of scope there for this to mutate into another variant. So there's another letter of the Greek alphabet that we're going to become familiar with. So if we want to go about our daily lives, if we want to help and support our hospitality industry by avoiding lockdowns, then yes, this is the battle that we need to actually embrace and get ahead of by making sure that we have a system in place that can get those vaccinations out without leaning once again on the NHS to provide it.
Can I ask about something slightly different? But we're going to be asked as a society for more money. And yet I still see for another day on the back pages and on the central pages of many of the papers, these adverts, which I'm sure are very expensive, get boosted now, they say. I guess it's a sensible message. But when we put in requests saying, can we have senior ministers come onto this programme, and thank you for joining us. But it has been very difficult to find voices from the government to come and talk to us. And yet very happy to spend millions and millions and millions of pounds on these adverts, combined with another story here, which is the MOD have spent £13 million on hire cars and taxis whilst making cuts to the army budget. Now, you might think, how on earth can I connect these? The point is that we are dealing with a government that seems not to be terribly interested in reducing waste and to spend taxpayers' money effectively. How on earth are we going to trust you as politicians and you as the government if you cannot spend our money wisely on the basis that you are going to come to us asking for more money, and yet this money is just being hoofed out as if it doesn't matter? It's being printed off the basis of the Bank of England because of quantitative easing, just going gung-ho, we need more money, spending whatever they want to spend, giving contracts to their mates, not reviewing things properly, not making sure that money that is spent is being effectively spent. And where is the accountability? And why are we spending people in government and into institutions and in quangos so much? You can only ask people to pay so much tax before they're going to rebel and before they're going to be really cross.
Well, I mean, you cover a myriad of issues there. Let's just firstly go to the communications point. When you're going through an enduring emergency such as this, and I touched on it before, it's so important that you keep the nation with you, that you take people along the journey, because you're actually asking them to do things that they wouldn't naturally want to do. So communications, command and control is absolutely pivotal. So if ministers are not coming on your program to explain, particularly at this juncture, as we're perhaps considering new restrictions or not, that's, it's simply wrong. They must be there. Biosecurity, from where I sit as chair of the Defence Select Committee, is now critical. This entire distraction, if you like, of the pandemic is giving space to our adversaries, our enemies, to take advantage to pursue their own agendas. We've got to get this right. We've got to get through it. What's happening in Russia, Ukraine, not even getting the headlines at the moment. And then you touched on the finances itself. Absolutely right. And this is, again, where I think Parliament expressed its views at the end of last year, or the end of this year, sorry, to say we want to be more involved to scrutinise how those funds are being spent, to make sure that, again, we don't lose the support of the British people in seeing money wasted. I'm pleased to see the government's put up its hand and said, we're going to have a wider review of this. That should be ongoing, because absolutely it's right to make sure we spend this money correctly. This is the taxpayers' money. It's the British people's money.
Well, it certainly is, and I just wish that there was more scrutiny on what's being spent, where it's being spent, and making sure it's spent more wisely. But perhaps that's raised the flag. There we are. We must leave it there for time reasons. Tobias Ellwood, Conservative MP and Chairman of the Defence Select Committee, thank you so much for joining us here on Talk Radio.